Good afternoon, Liam Bird. I am Mihiraa. Let's start the warm-up session. Can you tell us about your experience and qualifications?
I completed my medical degree at University Medical College and subsequently pursued a residency in gastroenterology at Urban Hospital. During my residency, I gained extensive experience in various gastrointestinal procedures and areas of expertise, such as colonoscopy, endoscopy, liver biopsy, and the management of inflammatory bowel disease. I am board certified in gastroenterology. I also have been practicing medicine for 5 years, during which time I have treated a diverse range of patients and conditions, providing comprehensive care to individuals with gastrointestinal disorders.
How do you handle high-pressure situations or emergencies?
In high-pressure situations or emergencies, my priority is to remain calm, focused, and efficient. I rely on my training and experience to quickly assess the situation, prioritize tasks, and make informed decisions. Effective communication with the healthcare team and clear delegation of responsibilities are essential for ensuring smooth coordination and optimal patient care.
How do you approach patient communication and building rapport?
Patient communication is a fundamental aspect of medical practice, and I prioritize building trust and rapport with my patients. I strive to listen actively, show empathy, and ensure that patients feel heard and understood. I believe in providing clear explanations about diagnoses, treatment options, and prognosis in language that patients can understand, and I encourage open dialogue to address any questions or concerns they may have.
How do you stay updated on medical advancements and best practices?
As a physician, I recognize the importance of lifelong learning and staying abreast of medical advancements and best practices. I regularly attend conferences, seminars, and continuing medical education courses to expand my knowledge and skills. I also subscribe to medical journals, participate in online forums, and collaborate with colleagues to exchange insights and stay informed about the latest developments in my field.
Can you provide an example of a challenging patient case you encountered and how you handled it?
I once encountered a patient with a complex medical history and multiple comorbidities, who presented with atypical symptoms that were difficult to diagnose. To address this challenge, I conducted a thorough assessment, consulted with specialists as needed, and pursued additional diagnostic tests to gather more information. I maintained open communication with the patient and their family, explaining the uncertainties involved, and involving them in the decision-making process. Ultimately, through collaborative efforts and persistence, we were able to reach a diagnosis and develop a tailored treatment plan that addressed the patient's needs effectively.
You can now start the role play.
Hello, Mihiraa. I'm Dr. Liam Bird. How are you feeling today?
Hello, Dr. Liam. Thank you for coming. I'm all right. Please come in.
Of course, Mihiraa. I'm here to check on your recovery progress after your colostomy procedure. How have you been feeling since you were discharged from the hospital?
It's been a bit challenging, Dr. Liam. I've been feeling some discomfort but not pain. Well, I feel like it's taking some time to adjust.
I understand, Mihiraa. Recovering from such a procedure can indeed be challenging. Can you tell me more about how you've been coping since the surgery?
Well, doctor, the discomfort is mainly centered around where the colostomy bag sits. It feels odd and can be itchy at times. Adjusting to managing the bag has been challenging. It feels like there's something extra attached to me, and it's quite noticeable because it bulges out and feels weird.
I acknowledge your concerns, Mihiraa. It's not uncommon to experience those sensations. Adjusting to life with a colostomy bag takes time, but I'm here to support you every step of the way. Let me reassure you that with time and practice, managing the colostomy bag will become easier. Make sure to keep the area clean and dry, using only mild soap when washing. It's crucial to maintain good hygiene. Apart from that, let's discuss some ways to prevent skin irritation. Applying a protective barrier cream or powder can help reduce friction and irritation. Ensuring that the bag fits well and changing it regularly will also minimize the risk of leaks and discomfort. You see, Mihiraa, these tasks are achievable, and I have confidence that you'll do your best.
Yes, I ensure these things.
Now, let's talk about making some adjustments to your diet to help manage your colostomy. It's often helpful to eat smaller, more frequent meals throughout the day to prevent overwhelming your digestive system. Besides, gradually increasing your fiber intake can aid in regular bowel movements and overall digestive health. Mihiraa, remember to stay hydrated by drinking plenty of fluids, as this can help prevent constipation and keep your stool soft. These dietary modifications can contribute to your comfort and well-being as you adapt to life with a colostomy. Do you have any concerns or questions?
Yes, Dr. Liam. I've been feeling a lack of confidence about my future. It seems like no matter what I do, I can't shake the feeling that things won't be the same anymore.
That's understandable, Mihiraa. However, I want to reassure you that there's hope and support available to help you navigate this transition period. Throughout the recovery phase, you'll have constant support from healthcare professionals, friends, and family who are here to help you every step of the way. It's also important to remember that life doesn't have to change drastically. You can still maintain an active social life and engage in activities you enjoy. Likewise, I will refer you to support groups or arrange counseling sessions that can provide valuable emotional support and guidance as you adapt to life after the colostomy. Remember, adaptation takes time and patience, but with the right support and mindset, you can overcome any challenges that come your way. You're not alone in this journey, and together, we'll work towards a positive and fulfilling future.
Thank you, Dr. Liam. That means a lot to me.
Of course, Mihiraa. We're in this together. Now, let's schedule a follow-up appointment for next week to monitor your progress and address any further concerns you may have.
Sure. Thank you, Dr. Liam. I appreciate your care and support.
All right, Mihiraa. If you have any questions or concerns before our next visit, don't hesitate to reach out. Take care, and I'll see you next week.